So Claudia is the co-founder and chief operating officer of Jelly Drops, and she's going to talk to us about proactively managing hydration needs for people living with dementia. And we know how important that really is. So thank you, Caroline. Sorry, Claudia, over to you.
Hi there, Leslie, and hello everybody. I'm just going to attempt to share my screen. Let's see. Okay, great. Well, hello everybody, and thank you very much for inviting us back to talk again at Malnutrition Awareness Week. And as Lucy said, I think it'll be quite hard for me to follow the other speakers, but thank you again, and it's been really interesting listening to some of the other speakers talking about the prevention side of dehydration and malnutrition in the community. Last year, my co-founder Lewis spoke about issues around hydration and dementia that he discovered during his research to help his grandma who was living with dementia. He soon found out, and as we've already heard today, and I'm sure you're aware, the issues faced by his grandma are very common and shared by many other people. And today I'm going to talk just a little bit about further learnings from our own community and how they find Jelly Drops can support hydration and how these insights translate into wider good practice for proactive hydration. So a couple of stats for you guys, which I'm sure you're already aware of. Dehydration can impact anyone, but particularly older adults. A fifth of adults in residential care can be dehydrated, and over a third of people admitted to hospital are dehydrated. And we also know that people living with dementia are significantly more likely to be dehydrated. And as well as the primary effects of dehydration, it's the knock-on effects such as UTIs and falls, which you've heard about today, that can also lead to this hospital admission. We have a quote here from an NHS dementia service manager highlighting that a hospital admission that can turn into a 2, 3, 4 week hospital stay is much more likely to have been avoided if the person was adequately hydrated when they were admitted. So what can make hydration difficult for people living with dementia? Well, as with many older people, they no longer feel thirsty, but also they can forget to drink, resist support to drink, perhaps no longer fully understand instructions to drink, and physically struggle to pick up cups or other hydration aids just due to reduced dexterity. So these were exactly the issues encountered by my co-founder Lewis's grandma Pat, who was admitted to hospital with severe dehydration because she was unable to adequately hydrate. And very sadly, the family were told to expect the worst. But after she was placed on IV fluids, in less than 24 hours, she was back to her normal, happy self. And quite rightly, Lewis was shocked that something as apparently simple as dehydration could have such an impact, and set about trying to find a solution to help his grandma stay hydrated. During his research, he found that although many people living with dementia struggle to hydrate, they often still very much enjoy and will help themselves to a sweet. And the idea for Jelly Drops was born. So Jelly Drops are essentially water in the form of a sweet. And here you can see Lewis with his grandma Pat enjoying the very first prototype of Jelly Drops. And after 2 years of development, and with the support of the Alzheimer's Society, we launched the first version of Jelly Drops in 2020, and since then I'm very proud to say we have supported the hydration of over 80,000 people. So, as mentioned on the last slide, Jelly Drops are sugar-free hydrating treats made with 95% water plus added electrolytes and vitamins, designed to boost independent hydration for people who struggle to keep hydrated, particularly those living with dementia. And they can aid independent fluid intake throughout the day and support overall health. And the current version you see here has been iterated on several times since our launch and developed very much hand in hand with our community. Everything from the drop size, the drop shape and the format has been updated due to these insights and customer feedback. And as well as insights about the physical aspects of jelly drops, our community have told us that a little and often approach to building jelly drops and other forms of hydration into a daily regular routine is one of the most effective ways to support hydration, rather than trying to encourage a large intake in one sitting. And a couple of insights here from, or highlights of feedback shared by healthcare professionals within the NHS. For example, jelly drops can help hydration without people feeling like they're forcing you to drink, which is precisely the aim. And again, from a wider community support groups, leaving the pot out in front of somebody is a great way for them to keep on top of their daily water intake, again, without feeling the pressure of being forced to drink. And we have seen in our early care home trial findings that this approach, using jelly drops as a regular top up as part of a daily routine, can be an effective way of helping people to meet their minimum hydration target for the day. But what do these stats mean in real terms of human impact? Essentially, adequate hydration can significantly improve the daily quality of life for somebody living with dementia, as borne out by feedback from carers, customers and relatives who have integrated not just jelly drops but other forms of hydration support into their loved ones' daily routine. And it's not just a knock-on effect of improved hydration, but jelly drops can also improve quality of life in other ways. One of the main aims of jelly drops is to provide, as well as hydration, is to provide a positive social interaction, essentially a playful way to incorporate hydration into a routine and to encourage consumption without pressure. So we've had such great insights from our community, and they've very much been instrumental in developing jelly drops into the format you see now, and we wondered what else we could learn. So we commissioned a standalone research piece speaking to carers, loved ones, healthcare professionals who care particularly for people living with dementia. And the two main insights may not come as a surprise, but for in-home carers and relatives of people living with dementia, there is a general lack of awareness around dehydration and dementia. They don't know that they can be connected until it becomes an issue. And people only start to look for a solution when their loved one has already been impacted by dehydration. And what we already know is, as mentioned, that routine and familiarity is very important for people living with dementia and also for their loved ones and carers. So what can we do with these insights? Well, Jelly Drops would like to help raise early awareness of hydration for people living with dementia and encourage proactive rather than reactive hydration as part of a daily routine. Very much echoing some of the earlier comments around early intervention. And to support this, we've created a free sample network, which we call our Champions Pack. And if you work in dementia or elderly care, or any of this is at all relevant to you, you can sign up to receive a free box of jelly drops to support your work. And please do consider including us in your hydration guide as an additional tool, and reach out to us if we can support you with any hydration initiatives that you're working on, because we'd very much like to continue the conversation about how we can support hydration for both the elderly and people living with dementia. So thank you very much, and hopefully as Leslie, I'd be very happy for you to share our contact if anybody wants to get in touch.
We will. We'll put all your contacts and how to sign up to receive some free jelly drops. We'll put that all on the website so that people can have a look and contact you. So thank you very much for your time.